Welcome to another episode of Follow the Brand. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. Welcome to the Follow the Brand podcast. I am your host, Grant McGaugh, CEO of 5-Star BDM, where we help you to build a 5-star brand that people will follow. And today we are diving into a topic that holds immense significance for the future of healthcare, specifically women's health in oncology. Our distinguished guest today, Dr. Priya Korrapati, is a true visionary who has been at the forefront of transforming medical education. As the CEO of eMedEvents, she has led the company's impressive growth from a small team to a global powerhouse, connecting healthcare professionals with the critical education they need. But her contributions don't stop there. Understanding the urgency and addressing the unique challenges in women's health within oncology, where disparities still exist and innovations are rapidly evolving, she is set out to create something truly extraordinary. And that's how the Her Health Oncology Congress was born, an event dedicated to advancing women's health by bringing together the brightest minds in oncology to share cutting-edge research and practices. With a background in artificial intelligence from MIT, she brings a unique perspective to the table, merging technology with healthcare to drive meaningful change. And today, we are going to explore how this Congress is poised to shape the future of oncology and improve outcomes for women worldwide. So please join me in welcoming a trailblazer in medical education and a champion for women's health, the CEO of eMedEvents and eMedEd, the driving force behind the Her Health Oncology Congress 2024, Dr. Priya Korrapati, on the Follow the Brand podcast, where we are building a 5-star brand that you can follow. Welcome, everybody, to the Follow the Brand podcast. This is Grant McGaugh, and I am so excited today. A lot of people have seen some of the things I've been posting about the Her Health Oncology Congress 2024. It's going to be in Orlando. I'm going to give you a ringside seat, I would say, up close and personal with the actual person who had the vision and the wherewithal to bring forth a conference, who has actually been doing a lot of conferences, a lot of events throughout the world. She said, hey, I want to do something special for oncology in Orlando. She contacted me. She said, Grant, let's do this. And I said, okay. So Priya, I'm going to introduce you to Priya Korrapati. And before I start asking her a bunch of questions, I want to know one thing from Priya, and that is, why did you want to do this conference in the first place?
Thank you, Grant. Thank you for bringing me in. eMedEvents launched the Her Health Congress to address a significant gap in medical conference landscape particularly in the area of women's health within oncology. We recognized there was a need for a specialized platform where healthcare professionals could focus on unique challenges and emerging trends in this field. Our goal was to create a forum where experts could share knowledge and collaborate on improving outcomes in healthcare, especially women's health, an area that is often been underserved in broad medical conferences.
That's so important. And I know you were recently in Chicago at the ASCO conference.
Yes.
And you met all these different people. There's so many different exhibitors there, sponsors there, speakers there. And you were saying they were so interested in eMedEvents and eMedEd. They weren't that familiar, but a lot of them had touched your platform, but weren't all that familiar with who, first of all, who was behind the scenes, yourself, and all those wonderful people that make up the company. Tell us just a little bit before we get into the Congress about eMedEvents.
So eMedEvents, we are a global medical education marketplace. We started with 3 people. Now we are a 120 employee company. And our main goal is to serve healthcare professionals with continuing medical education needs, provide them right CME and RCE.
So important. And how does that align? I mean, we think about eMedEvents, eMedEd, you get continuing education credits. I think CMEs are so important. You're combining that now with the kind of, how does that align with your overall vision?
So the Her Health Oncology Congress is a natural extension of eMedEvents' broader mission to advance continuing medical education and foster the knowledge sharing across the specialized areas by the healthcare professionals. So by focusing on women's health and oncology, we are aligning with our vision to lead in providing cutting-edge education opportunities. This event exemplifies our commitment to addressing critical and underserved areas in medicine, ensuring that healthcare professionals can access to latest research and best practices.
I think that's so important. So important, especially around women's health. There are a lot of key things that we worked through, some of the topics that we had. And, before we've got even the speakers involved, these are the things that are top of mind that don't always get a lot of the spotlight in the oncology field. You wanted to make something different around those lines. Tell us a little bit what you were thinking.
So this year, the Her Health Congress will spotlight the key themes such as advancements in breast cancer treatment, the importance of health equity, and the growing role of personalized medicine in women's healthcare. These topics are critical right now because we are seeing rapid development in these areas, and it's essential for healthcare professionals to stay informed. The discussions we will have are not just relevant, they're urgent, as they directly impact patient care and outcomes.
I think that's, as we went through the topics, that's what kept coming back out. And one of the things that you just pounded and you continually were talking to me about is that we have to be different. We've got to be unique. We've got to be able to attract the right kind of medical oncologists, the right kind of people that are in pharma, the right kind of people that have been in the medical device field, that they're not getting the opportunities in other conferences. So when they start looking at Her Health, they see something unique. Tell me more about that.
So the Her Health Oncology Congress stand out because it offers highly specialized focus on women's health oncology. It's a totally women's health oncology conference. Unlike broader healthcare conferences, we delve deeply into specific challenges and innovations in this niche area. What sets us apart in the combination of academic rigor and the practical insights that our expert speakers are bringing in? So, making it an invaluable experience. Those who are really looking for knowing the advancements in women's health. It can be breast cancer, it can be ovarian cancer, it can be lung cancer, it can be colorectal. It doesn't matter. It is when it comes to women's health in the direction of oncology, we are going to focus on that.
That's so important. So
That's
important.
Very important.
We've been talking about, I mean, the whole thing is very important. I love the focus. And then when we brought the perspectives to the different speakers, and I was able to reach out to a lot of different, women in oncology throughout the country. And I was like, wow, it would be so great. We had someone from the American Medical Association. And then we got the former CEO of the organization, Dr. Barbara McAnee. She's like, you know what? She's the first one we approached. She said, does this sound of interest to you? She said, let me clear my schedule, Grant. I am coming. We really need to have this kind of discussion because it's so important. We had the City of Hope that came out with Dr. Anita Johnson. We started to get people from UPMC. We started